Male erectile dysfunction is the inability of a male to attain a sufficient erection to satisfactorily achieve sexual intercourse. Approximately 50% of Americans between the ages of 40 and 70 will have some form of erectile dysfunction. Frequently, they're men who are obese, they smoke, they might have some problems with coronary disease related to their heart, and they might also have something called peripheral vascular disease, which is basically having problems with their blood vessels. Many men, they're very embarrassed about this, so they might not bring it up with their primary care physician, and it might delay detection and the more serious effects of peripheral vascular disease. Several other men in categories will also have problems related to their medication side effects, particularly medications for blood pressure and also antidepressant medication. And a small subset will also have problems related to their testosterone production. First-line therapy for male erectile dysfunction includes medications. Some other therapies would include things called intracavernosal injections. This is a simple injection of a medication into the side of the penis. And while patients will frequently have some anxiety initially with this type of treatment, most accept it and are very pleased with the response. Final two therapies I might suggest would be something called a vacuum-assisted device. This is essentially a plastic can that is placed on top of the penis, and a negative pressure is created with a pump. This simply just creates some blood flow into the penis. And then our final therapy would be really surgical therapy. The procedure takes approximately 1 to 2 hours, and patients can sometimes be discharged the same day or will go home the next day. They have extremely high satisfaction rates, not only for the patients, but the patient's partners, usually 90 to 95%. The post-operative course after having an implant placed is probably the most difficult for the patient, only because there's some typical pain and recovery associated with the implant. The pain are well controlled with narcotics, and people are usually back to their normal activity within 1 to 2 weeks. There is a training period that's required to learn how to use and negotiate the penile implant. And then usually the implant is successfully activated after approximately 6 weeks from the operation, and patients can resume intercourse. My name is Dr. Timothy Weber. I'm a general urologist with St. Joe's Hospital.